part 4. UB28 and UB32 location. UB28, 1.5 lateral to the posterior midline on the level of the second sacral foramen. UB32 is located on the fourth sacral foramen on the level of the superior end of the prima ani, sometimes a bit more superiorly or inferiorly. Place the little finger on the fourth foramen, then the ring, middle, and index fingers on a slightly V-shaped line in a superior direction, palpating for the depressions of the sacral foramina. With the fingers on this position, the middle finger would be on the second sacral foramen or the UB32, urinary bladder 32. Okay? Palpate po natin. Okay. Ang explanation po ng point, these 2 points are often used in problems of irritable bladder or difficult urination in prostate hypertrophy. The points are very close to each other at the height between the second and third sacral vertebra. The point UB32 should be needled into the sacral foramen for effect, okay? UB32 is used for painless childbirth with electrical stimulation or TENS. Yung TENS, ibig sabihin transcutaneous electrical nerve stimulation. UB28 is the Back-shu points of the urinary bladder. Tingnan po natin sa drawing, okay? Let's go to UB37 or urinary bladder 37. Location, 6 distal to UB36 or the gluteal crease on a line connecting UB36 and UB40 in the popliteal crease in a gap in the musculature. So may muscle po. Point explanation, a meridian distal point. This is used mainly in low backache. It is also used as a local point in sciatica. A very deep point which should be needled 4 to 5 centimeter perpendicularly to be of effect. Okay? Let's go to UB39. Location at the lateral end of the popliteal crease on the medial side of the tendon of the long head of the biceps femoris muscle. Okay? Point explanation. The lower C point of triple warmer. This is often used against edema anywhere in the body and is excellent against Baker's cyst. UB39. Nasa drawing po. UB40 naman, ang location is in the center of the popliteal crease between the tendons of the biceps femoris and semitendinous muscle. Okay? Point explanation, the area distal point for the entire back. This is used in backache very successfully, but it is also the earth point of the urinary bladder and increases dampness in the meridian. So, see controlling cycle po. Okay. I would not use it if there is a yin pain, such as when starting to move from rest with a lot of stiffness. I would prefer point UB37 in this situation. Okay, magandang point po yan. UB40. Next, UB54. Location, 3 tune lateral to the posterior midline on the level of the fourth sacral foramen, approximately at the center of the buttock. Sa may dito sa puwet. Point explanation, on the second parallel line to the Du channel, this is the best local point to be used in sacroiliac joint problems and in osteoarthritis of the hip joint together with the point GB30 or gallbladder 30. Okay? Tingnan po natin yung drawing. Let's go to UB58 naman. Location, 1 tune distal and 1 tune lateral to UB57 or 7 tune proximal to UB60 at the posterior border of the fibula and at the lower border of the nemus muscle. Point explanation, the loop connecting point of the meridian, it is best used in situations of stagnation of dampness in the organs or meridians, stiffness and pain of the back when beginning a movement from rest, fibroids, hypertrophy of the prostate gland, Baker's cyst, and rest urine in the urinary bladder. This 1 point can balance the yin stagnation, UB58. Okay?